Hi, I'm Tasha, and this is Parents of Mouth Breathers, a podcast for parents who are done being dismissed and who are ready to advocate for their children's health. So, welcome back to the podcast. This is an episode about going to ENT appointments, what to know before you go, and what to expect. This is all through my lived experience. Now, ENT departments are where so many of our children end up, but so few actually get what they need. So, I want to use this as your pre-ENT pep talk, learning what to ask, what to bring, what to expect, and what not to take lying down as well. So, ENT, first of all, I want to open this up, although it is a component, it is an important aspect of figuring out how to treat your child's airway dysfunction. It isn't the ultimate answer, and it certainly isn't the whole picture, but you do still need to go. So, many of us are told your child needs to see the ENT as if it's some magic fix. And maybe for some kids it is. If you've got a child, say, with enormous tonsils or raging glue, a good ENT can make the world of difference. But the reality is, ENT isn't an airway clinic. So it's not always holistic and it's not always helpful unless you know what to ask. So most NHS ENTs look for very specific things. They're looking for infections, obstructions, and ultimately surgical cases. They treat through surgery. So they are not routinely trained in myofunctional issues, tethered oral tissues, or sleep disordered breathing either. So if your child isn't turning blue, you might get told they're absolutely fine, which is why we have to prep ourselves. Now, with my first ENT visit, which I've gone through in a number of these podcast episodes so far, I thought it would be a turning point. I was so excited. I'd been really holding out for it, thinking that this was going to be where we were going to get answers and where we were going to get acknowledgement for our concerns with our son. But instead, it was 5 minutes, a quick peep in the throat, but they didn't really ask about sleep. They didn't ask about his behavior. I pushed, the fact that I think that he's got sleep apnea and I wanted to get a sleep study, which they were slightly reluctant to do. And the ENT surgeon didn't listen to what I'd been seeing basically for months. I took a couple of books in there, Breathe by James Nestor and Jaws as well. And he didn't want any part of it. I left that appointment thinking, like, was that it? We've waited this time since the GP referral, and you get 5 minutes in the room with a surgeon that takes a brief look. There was no apparatus used, there was no equipment used. It was just like a quick look in the mouth to see what the tonsils look like on that day. He did acknowledge that the tonsils looked slightly enlarged, but that he'd basically seen worse. I was just so frustrated because I knew at that time of year as well, it was like we're going to go home for another however many months before the sleep study's done. And it's another winter of, viruses and whatnot and going through all this stuff. And I realized at the time that ENT wasn't going to save us, but I knew that we had to go down that route. In the interim, I did a few other things as well. I went to see an airway dentist and I went to see a cranial osteopath for my son as well. But I knew that I had to wait it out with the sleep study and everything. So, what I want to say to you is when you go into an ENT appointment, think about how many hours they sleep, how often they wake, whether they snore, sweat, or gasp. I know it's difficult, but do it anyway. There are some monitors that you can get as well. I think the Owlet is one. Maybe that's just for slightly younger children, but that's one that I've heard of. Videos of sleep, 10 to 30 seconds of snoring, the pauses in the breathing, the gasping, the stuff that they won't see in the clinic. I think that's really important. What stuck out to me on that first ENT visit is he was looking at my child on a day where, it might seem that everything's normal, but ultimately he's not witnessing the primary concern that I had, which is the apnea episode at the time. Obviously, photos, day and night of them breathing through their mouth, any written history as well of things like infections, antibiotic, all those kind of things is important to bring in because though these systems are supposed to be interconnected, they don't talk to each other. I would say notes on behavior as well, that can't hurt. Any reports of hyperactivity, tantrums, that kind of thing, because they're not going to ask. They're not going to ask for any of these things. They want to get you out of the room as soon as possible, in my experience. But if it's documented, they obviously can't ignore it. So I would print it, hand it over to them, and you're not being difficult, you're not being too much, you're being thorough because no one else is going to connect those dots for you. then go in with questions. You don't want to overwhelm the ENT surgeon, which I think I did the first time I went in. I went in, I think, with too many questions, but think of, say, 3 to 5 clear ones that matter, whether their tonsils or adenoids appear enlarged. Like, obviously, with the adenoids, they can't see them as well as they can the tonsils. Ask, could this be contributing to sleep disordered breathing? Would they benefit from a sleep study, or more directly, can you arrange a sleep study? Do you think this is impacting oxygen levels or behavior? And ask what the criteria is for surgical intervention as well. If you think your child has hearing loss linked to potential gluea, that's also really worth asking. I didn't even remotely think of that at the time. That was sort of a separate referral. But they are ultimately the ones that would treat things like gluea with grommet. I would definitely ask that as well, especially if your child's got some speech delays or things of that nature. If they brush you off, I would be very clear that it is affecting your child's quality of life. Say that you want that documented, that you've said and you've noticed that it is affecting their quality of life. Because once it's in the notes, it is harder to ignore. And at least there's that record there that you've brought the severity of it to the forefront. Now, there's a few things the ENT won't tell you, but you definitely need to know. So, one of them is tongue tie. Unless it's super, super extreme, you're probably never going to have a conversation about tongue tie with an ENT specialist unless you bring it up. So, I would certainly ask to be assessed on the spot for tongue tie, because that can definitely contribute to mouth breathing and airway dysfunction. Again, mouth breathing being a big red flag. Talk to them about it, get their insight into mouth breathing, and also you're alerting them to the fact that you are aware and you are attuned. You're not just sitting there taking their word for it, you're actually trying to get information on it. Then ask them about the impact of poor sleep on things like emotional regulation. Put them on the spot. See if they know what they're talking about. Ask them, okay, if my child is presumably having their sleep impacted, their oxygen absorption impacted, what are the effects on emotional regulation? See what they know, what their research is, what their level of education is on this type of thing. Go in there and get some answers. Whilst remembering this is just one opinion, it's still important to get some insights on it. It could be a case that actually you really hit it off with the ENT surgeon and they're forward thinking and actually they know about things like sleep disordered breathing. When I first went to ENT, I was of the opinion that, like, well, my child doesn't have tonsillitis. He's never had a case of tonsillitis. He's never had to be treated with antibiotics for an infection of the tonsils. So I was really confused. I didn't understand at the time, what the connection was and why that was sort of the primary treatment. But now I realize that actually is because the tonsils, when they're enlarged, they're an obstruction of the airway. I learned that there were different types of sleep apnea. So you've got central sleep apnea and obstructive sleep apnea. So obstructive sleep apnea is the most common. It's most common in children as well because it's caused by an obstruction, a physical blockage. So in this case, for my son, it is obviously the tonsils in the upper airway, the adenoids, a small jaw as well, or poor tongue posture. Effectively, that's when during sleep the muscles relax and the airway collapses or narrows, making it harder for the child to breathe. So as the body's trying to breathe and they can't get air through, the child then snores, gasps, or wakes briefly as well. That can be worsened by mouth breathing, allergies, or tongue tie or gluea. And then there's central sleep apnea, which is less common in children, but it's caused by a neurological issue. So it's the brain not sending the right signals to the breathing muscles. It's almost like the brain forgets to tell the body to inhale. And that's seen more often, as far as I'm aware, in like premature babies, children with neurological conditions, or sometimes during deep sleep transitions. If your child is struggling with sleep and gets a sleep study, it effectively should show whether the apnea is obstructive, central, or potentially mixed. So that's really important to know as well. But these things aren't talked about in the clinic. And I certainly wasn't asked any questions about how he presented when he was sleeping. That was very much about me pushing my concerns. They might look at the tonsils and say, yeah, everything's fine, or they might dismiss it because it doesn't appear really severe, and they might send you away with a nasal spray and a follow up in 6 months. It doesn't mean your child's okay. It just means the system is risk averse, very overrun, and it's up to you to utilize it as much as you can. And that's why it's key to know the right turns of phrase and the right terminology to use. So the bottom line of it is ENT, in my experience, is just part of the solution, but you're still ultimately the one carrying the whole puzzle piece and trying to figure out which parts that your child needs in order to offer the treatment that can help them with their specific issues. So it's important that when you go into an ENT appointment, you go in really grounded, you bring your notes, your videos. Don't be afraid to speak off. If they fob you off, it's important not to take it personally, which is hard in my experience. Take it seriously and plan your next step. Know, as I said, that ENT isn't the be all and end all. It is just one component. Your child's sleep isn't a waiting game. It's not a let's see if they grow out of it kind of thing. It's like, no, all the while that they're not getting the sleep that they need and the quality of sleep that they need is affecting everything about their development. It's their brain, their growth, their oxygen, everything. So I'll leave you with that for this episode. I hope that your ENT appointment gives you some answers and provides you with some of the next steps. But just a final reminder that you have to start accepting that this is a multidisciplinary approach and the ENT appointment is just one aspect of it. So thank you so much for listening to Parents of Mouth Breathers. Please share this with someone if they're about to have an ENT appointment as well. We can feel really alone in that, really overwhelmed and sometimes a bit intimidated in the room of, a perceived specialist. And obviously, if you're there right now yourself, just know you're already ahead. You are already thinking in the right way by looking into this and being informed because you're asking questions that really matter. So I will see you next week. Thanks so much.